going to test us on the nursing process and also communication techniques. She said there's going to be about um, she said that there's going to be about 1 to 2 questions regarding communication techniques. So she was saying that questions utilizing the nursing process. So that's just ADPI, she said. So assessment, prevention, and then evaluations, the outcome, did you reach the goal, questions like that. Um, yeah, so this is just like the same thing she said that was going to be on the midterm. Um, and then there's also communication techniques she said that there's going to be. So she said think back to psych, so responding skills, what the nurse says to the client, um, what's therapeutic, so what helps the client continue talking, focuses on the client's thoughts, feelings, and behaviors, what works in opening communication. And then we all know the non-therapeutic, that's not effective, what locks, closes, and stops communication. And then just these are just a list of things that are ineffective things to ever say. And then this is just from psych. So she said there's only going to be 1 to 2 questions with communication. So chapter 5 deals with frameworks for health promotion, disease prevention, risk reduction. And in other words, the title just means that it's to promote health. We want to reduce risk to prevent disease and disability. The whole idea with community health nursing. Um, so these are the PowerPoint notes she said to look at in the ETI. So I just followed the study guide. And I believe I sent it to everyone's emails just now. Okay. So primary prevention, so same thing as for the midterm, you always want to maximize health and wellness through strategies that are set in place before illness or injury is present. So that's all dealing with education because you want to prevent, the disease or illness from actually happening. So everything regarding education as well as immunizations and things like that. And then secondary prevention, you're maximizing health and wellness through strategies that are set in place at the early and active chronic stages of the pathogenesis of illness and injury. So this mainly just deals with screenings and assessments, and all those examples are there. And then she said she's going to test us on motivational interviewing. So that's slide 15. So she said only to look at motivational interviewing. We don't want to look at the behavior change models, but I just put it there. So this is just client-centered communication style for eliciting behavior changes by helping clients and groups explore and resolve ambivalence change. And ambivalence is that word from psych last semester. So those two opposing feelings going on at the same time. So we see this with suicidal patients. They have the thought that they want to die, but then they also have the thought that they don't. And then also alcohol abuse patients, they want to get sober, but they also want to keep drinking. And then also diabetic patients who want to adhere to a diet, but it's difficult for them, like giving up certain carbohydrates because there's an ambivalence there. You always want to remember that motivation is something that you can modify, that we can help the patient with. The goal is always just try to redirect the clients, families, and communities back to health and well-being. And well-being is always subjective. This process is to help clients explore how they are feeling about the behaviors they have to change. So you're just trying to get the patient to keep talking to see how they are feeling. And then she also pointed out some textbook notes. So motivational interviewing is defined as directive client-centered communication style for eliciting behavior change by helping clients or groups to explore and resolve those ambivalent feelings that they're having. Um, motivational interviewing is focused, goal-directed approach. Yeah, and then there's like a good example here. So it originated with people who consumed alcohol in excess, who presented themselves to clinicians. They needed help to change a behavior, or they wanted to continue it. So they're having those two opposing feelings. To address the behavior change using this method, the motivation comes from the client and is not imposed by a clinician. The client needs to resolve ambivalence to change a behavior with autonomy. Persuasion on the part of the clinician only intensifies resistance. So you want to help the patient just get to those feelings on their own. The communication style is therefore one of the directing the client to examine and resolve those ambivalent feelings. So this method does not argue with the group or community by insisting it has a problem that needs to change or offer advice without actively encouraging group identified choices. Give advice while the group is put in a passive role, impose diagnostic labels, or use coercive tactics. Motivational interviewing teaches all clinicians that making efforts to change behavior is based on a clinician-client exchange. That's just the whole idea with it, is that you want the client to get there on their own to change those ambivalent feelings by asking them questions and things like that. And then the next thing she listed was something that we can bring to the final. So that's just table 5.3. And you look on, it's a chart, and you just look under spoken word. So we are allowed to bring that table in. And then there's effective questioning. So ask me 3 good questions for good health. It's just an effective tool for community health nurses to teach clients to ask their healthcare provider. The questions are, what is my main problem? What do I need to do? And why is it important for me to do this? So it's always important for a patient to ask these questions just so they know what's going on with their condition. So it's a guide for clients encouraging them to speak up and ask questions, and they're useful in focusing important conversations. And then it also just says that community health nurses can also use these three questions to structure how they share information with clients to ensure that all the answers are answered and that they're not confused with anything. And I believe we can bring this to the final two. And then chapter 6 deals with epidemiology. So we all know the epidemiologic triad. So she says there's going to be 2 questions on the actual triad. But this is the handout we're allowed to bring from the midterm. So slide 12 just goes over the actual epidemiological triad. We know that there's characteristics of the host, agent, and the environment, that there's not just a single factor playing into a disease or infection. Wheel of causation, however, de-emphasizes the agent, those hazards, as the sole cause of disease, while emphasizing the interplay of physical, biological, and social environments. So in the wheel of causation, these environments are the most important parts to consider. And then this is just some textbook notes of the epidemiological triad, but it's all the same thing. Yeah, it's all the same thing, and we're able to bring that to the final. The web of causation is the epidemiological model that strongly emphasizes the concept of multiple causes while de-emphasizing the role of agents in explaining illness. So it strongly emphasizes the concept of multiple causation while de-emphasizing the role of those agents or those hazards. At the time of development, there was a need to create a model that would help describe the multiple complex and interrelated factors underlying chronic illnesses. Yeah, it's just all the same thing. The main thing is just to know like the definition, and she says we can bring that to the final. And then there's just a picture here, just saying that there's multiple things adding to it. Tertiary prevention, so same as the midterm, maximizing health and wellness through strategies that are set in place at the palliation and end stage of disease and injury trajectory. So basically just reducing the limitations of disability and promoting rehab following health alterations. And then you have all those examples there. And then you have all the definitions of risk factors. So characteristics or events that have been shown to increase the probability that a specific disease or illness will develop. And then she also added the textbook definition here. So risk factors are those characteristics or events that will have been shown to increase the probability. So same definition here. Some risk factors are modifiable and others are non-modifiable. Epidemiological research has established that certain risk factors, such as a sedentary lifestyle, obesity, increased cholesterol, hypertension, and smoking, are associated with cardiovascular disease. So those are going to be your modifiable. These risk factors are now a part of the epidemiological body of knowledge or the epidemiology of heart disease. As a result, several health appraisal approaches are now commonly used to profile client risk. And then you have your wheel of causation, which we were talking about before. So it's just the wheel of causation. So that's a model that de-emphasizes the agent as the sole cause of the disease, so that hazard. So while emphasizing the interplay of physical environment, social environment, biologic environment. So many diseases, illnesses, and conditions have multiple or no discernible agents, or the agent may be part of the environment. An alternate model is conceptualized as a wheel with a circle of the genetic core of the host surrounded by a larger segmented wheel representing the biologic, physical, and social environments. The wheel of causation de-emphasizes the agent as the sole cause of disease, whereas it emphasizes the interplay of these three things here: physical, biologic, and social environments. So interaction between your host and environment with or without an identifiable agent remains the major determinant of health status in all epidemiological models. That's an idea with the wheel of causation. And then how to investigate an outbreak. So this is just the table box on page 156. These are sort of like the same thing as like they were talking about in ATI, how to investigate an outbreak. So you're going to establish the existence of an outbreak, describe the outbreak according to person, place, and time, formulate and test hypotheses as to the most probable causative factor of the outbreak, implement a plan for control of the outbreak and prevention of further outbreaks, and then evaluate results, prepare reports, and conduct further research if necessary. So it's just following basically ADPI, how to investigate one. Chapter 7 is describing health conditions, understanding and using rates. So what a rate is the primary measurement used to describe the occurrence, frequency, or quantity of a state of health in a specific group of people in a given time period. So a rate describes the occurrence. So this says the same thing. It's just the textbook notes too. Rates are used to quantify either the occurrence or just known as the incidence. Incidence is going to be like your new cases or people who are at risk, or the existence, prevalence of states of health or illness. And then on this slide, she just wants us to look at it right. The primary measurement used to describe the occurrence, quantity of a state of health in a specific group of people in a given period of time. And then we have to look into prevalence rates. So your prevalence rates is measuring the number of people in a given population who have an existing condition. So they already have the condition at a given point in time. Both incidence rates and prevalence rates can be measures of morbidity, a departure from a state of physiological or psychological well-being. Prevalence rates measure the number of people in a given population who have a specific existing condition at a given point in time. We don't have to pay attention to the math of it. But there are two types of prevalence rates. I don't know if she's going to test us like on the types of it. I don't think so. But period prevalence indicates the existence of a condition during a period or an interval of time, often a year. Point prevalence refers to the existence of a condition at a specific point in time, provides a picture of an existing situation for a group of people. Prevalence is influenced by two factors: the number of people who have developed the condition in the past and the duration of their illness. The longer the duration of a condition, the higher the prevalence rate. Prevalence statistics are very important in identifying public health problems that exist in a community. They are particularly useful to health planning and professionals because they measure the burden of a condition or illness in a community. This information documents the need for developing programs such as the initiation of primary, secondary, and tertiary prevention strategies for people who are at risk of that disease. So also these data provide the rationale for modifying facilities and hiring staff to meet the requirements of the community. Yeah, so that's then you have what the ATI book says about it. So they're used to measure the existence of a particular disease and allow the nurse to compare the rate of disease in one population to another. So incidence is going to be your number of new cases in the population at a specific time. Prevalence is your number of existing cases in the population at a specific time. And then this is just a PowerPoint note. Incidence rate, a measure of the probability that people without a certain condition will develop that condition. So mainly is looking at the people at risk. Prevalence rates measure the number of people in a given population who have an existing condition at a given point in time. Remember, when we talk about community health, public health nursing, the client is the population, groups of people, looking for groups and populations. That is the client in community public health nursing. That's just like the whole idea about it. Sensitivity definition, so it's ability of a test to correctly identify people who have a health problem. The probability of testing positive if the health problem is truly present. And the textbook note is just the same thing. Not my favorite choice, but that's just what the textbook says. Yeah, sensitivity. Sensitivity and specificity. Sensitivity, the ability of a test to correctly identify people who have the health problem under study, which is just saying you have the disease. Specificity, the ability of a test to correctly identify people who do not have the health problem. So the level of prevention, sensitivity, and specificity is secondary because they are screenings. And then you have incidence rate, which is the measure of the probability that people without a certain condition will develop that condition over a period of time. And there's an example within the textbook, just saying that an incident rate, also occurrence or attack rate, is a measure of the probability that people without a certain condition will develop the condition over a period of time, often a year. It measures the pace at which new illnesses such as COVID-19 occur in previously disease-free group of people. That's a little example there. And then this is just the same thing. I just put it again for incidence. And again, this is the same thing. Chapter 19 looks at environmental health. We're allowed to bring the handout that she shared with us for the exposure pathway. So that's the handout. Biomonitoring, which is on slide 12. Toxicology is the study of the adverse effects of chemical, physical, or biologic agents on people, animals, and the environment. An exposure estimate determines a person's level of exposure to a contaminant. Bioavailability is the amount of a contaminant that actually ends up in the systemic circulation. Biomonitoring is the process of using medical tests such as blood or urine collection to determine if a person has been exposed to a contaminant and how much exposure they have received. I just put the whole slide, but I believe we just need to know biomonitoring. So yeah, process of measuring environmental chemicals or their breakdown products in human tissues and fluid such as blood and urine. Environmental epidemiology. Epidemiology is a field of public health science that focuses on the incidence and prevalence of disease or illness in the population. Before the words were frequency and distribution, and now they're replacing those with incidence and prevalence. So environmental epidemiology is the field of public health science that focuses on the incidence and prevalence of a disease or illness in the population from exposures to their environment. So yeah, exposures is contact between a body and a contaminant. So a person with a contaminant. So you remember that the exposure pathway needs to be interrupted, and if it's not interrupted, um, if it is interrupted, then it doesn't not complete. That's the whole idea about that with the handout she gave. Um, Environmental epidemiology, field of public health science that focuses on the incidence and prevalence of disease or illness in the population from exposures in their environment. Children's health and their environment. So, vulnerability. Children are particularly vulnerable to contaminants in the environment. They are a vulnerable population. Um, their body systems are still rapidly developing. They eat, drink, and breathe more in proportion to their body size than do adults. Breathing zone is closer to the ground, so they're closer and um, near soil, dirt, compared with adults. So their bodies may be less able to break down and excrete contaminants. Behaviors can expose them to more contaminants like pica, so that's just an unusual behavior of eating substances like dirt. Spending time outside home where environmental hazards may be present. Chapter 14 is the risk of infection and communicable diseases. Um, she said we can bring page 25 of the ATI book to the final. So chain of infection, slide 7 is epidemiology is about the incidence and prevalence of a disease. So you have your agents, which is also known as your hazards, host, which is a person or an animal, portals of entry and exit, and your incubation period. Um, Epidemiology of infections process. Epidemiology is about the incidence and prevalence of a disease, agents, hazards, host, portals of entry and exit. She just put that slide twice. Textbook, you have your epidemiological triad, um, where you have your agent, host, and the environment, which helps us understand how infectious diseases are spread. So that just like repeats itself again. There's also droplet transmission. Um, she said to add this paragraph. So, although some infectious agents transmitted by droplets may be transmitted by direct and indirect contact, droplet transmission is considered a separate route of transmission. Respiratory droplets carrying infectious agents transmit infection when they travel directly from the respiratory tract of the infectious individual to a suspectable person. Droplets are generated from the respiratory tract of an infected person by coughing, sneezing, or talking. These droplets are then propelled a distance of less than or equal to 3 feet through the air and can be deposited on the conjunctivae, oral, and nasal mucosa of a suspectable person. And then she just wants us to know these definitions. So we know that an endemic is just that constant, usual prevalence of a disease. So just like the norm within that specific area, that specific population. And then slide 15 just goes into it. So yeah, so endemic is just that constant or usual prevalence of a specific disease. Um, Epidemic is when there is a significant increase in the number of new cases of a disease than past experience would have predicted for that place, time, or population. So this is constant, and then now there's a significant increase within that population. And then an outbreak is the same definition as epidemic, however, to a limited small geographic area like Brooklyn Heights or Bay Ridge. So this is like a smaller area. And then pandemic is that outbreak that can spread worldwide. And then common source outbreak is an outbreak characterized by exposure to a common harmful substance. So slide 18 goes over outbreak investigation, establishing. So this is sort of the same thing we were talking about before. Establishing the existence of an outbreak, contact tracing. You want to identify individuals who have contracted a disease and the people that have come in contact with. So an example of that would be like sexually transmitted diseases. And then you ask the client, who have you been intimate with? Common source outbreak. All of these people who have been affected have been exposed to this harmful substance. And then propagated, continuous outbreak. We get secondary infections. And then there's also foodborne diseases. So this is also what we can bring. So these are all examples of foodborne diseases. The one starred is the ones you have to add to that list in the ATI book that we can bring. Yeah. And then you have pathogenicity, the ability of the agent to produce an infectious disease in a suspectable host. And then infectious diseases, so presence and replication of an infectious agent in the tissues of a host with manifestation of signs and symptoms. So again, you have same definition here. And then there's also vector-borne infections, like those mosquitoes, like West Nile virus. That's all on page 25 that we can bring. And then chapter 16 is violence and abuse. She said to know secondary prevention of intimate partner violence. So ATI review book is page 8, slide 12. So we all know what secondary prevention is. So maximizing health and wellness through strategies that are set in place at the early and active chronic stages of pathogenesis of illness and injury. So those screenings and assessments. Lethality risk. So that's just when you're checking if a patient is suicidal or all those risks. So that would be, is there a gun in the house? Is the woman's partner unemployed? What is the worst thing the partner has ever done to the victim? Does the victim feel the partner is capable of hurting her, of carrying out his threats? Has the woman's partner ever been arrested? Is the woman's partner using drugs or drinking excessively? And then tertiary prevention is just repeated again. I just followed the guide she sent, so it's tertiary there again. Risk factors that indicate significant concerns for the safety of children. So threats to kill the caretaker, children, and or self. Caretaker fears for the children's safety. A child was physically injured in an incident when the caretaker was the target. A child was coerced to participate in or witness the abuse of the caretaker. A weapon was used or threats were made to use a weapon, and the caretaker believed that there was intention and ability to cause harm. And then safety planning is in that handout that we're allowed to bring. Femicide is a term used to refer to homicide that occurs in the context of intimate partner violence, gender-based killing of women and girls, the most serious form of gender-based violence. An assessment of intimate partner violence, therapeutic communications. That's where one of the communication questions are going to come in. And then chapter 20 is community preparedness, disaster, and terrorism. So she says we can bring page 75 to 76. And that handout from the midterm of a emergency preparedness plan and disaster management. So you have the START model, so simple triage and rapid triage. Those who have died, injured requiring immediate transferred, injured who can wait to be transferred, injured with minor less urgent needs. There's a little bit about a shelter in place. Yeah, high toxicity and short duration. Just a little bit about that, but it's used for short duration incidents when moving would result in a greater hazard or it is impractical to evacuate. So yeah, it's just repeated again here. Role of nurses in a chemical disaster. In the field, the public health nurse response to a chemical incident is summed up in 2 words: act quickly. Hazmat experts report to the hot zone on notification of the release of the chemical. The nurse may be asked to report to a temporary evacuation site where people exposed to the chemical are awaiting triage. Want to don PPE must be the first priority. Then assessment of the victim's ability to breathe is necessary. Maintaining the adequate respiratory function tops the list for effective client management in a chemical event. Keeping the victims in a sitting position with constrictive clothing loosened or removed is necessary. If the client cannot sit, the torso should be elevated. Field decontamination of the victim requires the removal of as many outer layers of clothing as possible and placing the victim at a good distance from the unaffected population. Washing with soap or at least water should follow. For more thorough decontamination, field tents must be erected nearby. Victims who have been severely compromised by the chemical release will be transported to the hospital. There, they will undergo decontamination on the facility grounds before being admitted to the emergency department. The nurse later is responsible for maintaining communication, especially updating the receiving institutions on client transfer and clinical status. The final activity is for all those working at the decontamination site to be fully decontaminated. So that's just it in depth, but there's also the slide notes. Stay or go. The evaluating factors include the following: the hazardous material involved, the population threatened, the time span involved, and the current and predicted weather conditions, and the ability to communicate the emergency information. Um, Agents of bioterrorism. Yeah, so we're allowed to bring the ATI review book. So with these pages, you said those are going to be true false questions on these pages. So, like, is there a treatment for this biological agent? What is the mortality rate? And there will be a statement, and we have to just answer if it's true or false. And then there's 50 multiple choice, and I think she said there's one response question. That's it. Does anyone have any questions? Okay. Um,